When I think about how my life has changed since the Tecnis Multifocal lenses, it makes me laugh because for the first month, I kept reaching for the top of my head for my glasses, assuming that I should still be wearing them, and I don't wear them anymore. I do a lot of work on computer, and it's made it much simpler for me to go from whatever computer input I'm doing to being able to look at the screen. It's made driving simpler. It's made crossword puzzles simpler. It makes everything much simpler. With the Tecnis Multifocal lenses, my near vision is clearer, sharper, and my eyes don't get tired. And that's worth a lot since I do work on computers most of the day. Before I got the lenses, I had to adjust my computer screen more often. And I work in an office with numbers, and I have 2 computer screens. And so the adjustments between the 2 was really time-consuming, irritating, and all that's gone away since I got the lenses. Following having the Tecnis Multifocal lenses implanted, the adjustment period was much shorter than I had anticipated. Actually, within 48 hours, when I had the left eye done, I had very clear vision. When the right eye was completed a month later, that adjustment period was 4 or 5 days, and by the end of both, then my vision was really great, and I don't wear glasses anymore for either eye. I had been told by the doctor that there would be some haloing, but it would go away. My vision in both eyes is so good, it doesn't bother me very much.
Hey, Lena. Let's
Hi,
go
Victor.
ahead and read a little bit for me here. Let's bring that up a little bit. And
Okay.
go ahead and read a little bit, please.
Healthy soil is the basis for any garden, and that goes double when you're growing vegetables. It's important to learn as much as you can so your soil will have the right combination of elements and nutrients to make it rich and fertile.
Perfect. Let's go out a little bit more. Let's see where. How about that?
That's good. Most vegetables need lots of light. Fruiting crops such as tomatoes and eggplants require 6 hours of full sun each day. Maximize the light you have by placing tall crops where they won't block small plants.
Perfect. So we were at 14 and about 22 inches. Great.
It felt good.
Good.
Since getting the Tecnis Multifocal lenses, my activities have changed a great deal, both at work and my personal life. At work, what's happened is, because I'm on the computer a great deal, and when I'm not on the computer, I'm looking at numbers somewhere else, the fact that I don't have to search over and over again for my glasses to go from one venue to the other is really wonderful. Also, I don't have to spend half my day trying to figure out how to clean my glasses when I put them down someplace. The other part of it is that activities that I participate in after work and on weekends, I dance, and I take lots of dance classes, and not having to strap them on my head or wonder what's going to happen if I can't see points up ahead of me has really changed the way I do that. It's also changed how I walk. I realized that with glasses, I walked looking down because I was always concerned about what was in front of me because I had trifocals. And so having to adjust my head to see where I was going to walk was always important. But without having that, I can now walk and I can look at flowers and look at what's ahead of me, and it's much better. What's interesting about the walking is that I hadn't really paid attention to it until one day I sort of stepped into a gopher hole, and I don't remember ever doing that. And I've had glasses since I was 20 years old. And the reason I stepped into it was because I wasn't looking down at the ground all the time. But I can tell you what the landmarks are when I walk on 4th Street in Santa Monica or when I walk wherever now. So that's a big difference. I have already recommended Tecnis Multifocal lenses and this surgery to friends and family and coworkers and anybody who will listen for 30 seconds. All I would say to anyone who's considering getting Tecnis Multifocal lenses and this surgery is that you will be surprised and overjoyed at the fact that it's easier than you could imagine, that the results are terrific, and the process takes less time than you probably imagine. Go ahead and do it. It's terrific. It's a process that was much easier, pain-free, efficient, wonderful people. The lenses are great.
Federal law restricts this device to sale by or on the order of a physician. Tecnis Multifocal intraocular lenses are indicated for primary implantation for the visual correction of aphakia in adult patients with and without presbyopia in whom a cataractous lens has been removed by phacoemulsification and who desire near, intermediate, and distance vision with increased spectacle independence. The intraocular lenses are intended to be placed in the capsular bag. As with many things, there may be a trade-off. If you decide to have a multifocal lens, your use of glasses may decrease, but at the cost of losing some of the sharpness of your vision. Even with glasses, this loss of sharpness may become worse under poor visibility conditions, such as dim light or fog. There may also be some visual side effects, such as halos and glare from lights at night, that are more common than with a monofocal IOL. Halos are rings of light that you may notice when looking directly at a source of light, such as oncoming car headlights. Glare is a scattered light effect that can appear around a source of light. General risks with cataract surgery and IOL implantation. Whatever your lens choice is, there are risks and possible complications of cataract surgery and lens implantation. Complications could be minor or temporary, or could permanently affect your vision. Complications are rare and may include the worsening of your vision, bleeding, or infection. Contact your eye doctor right away if you have any of the following symptoms after surgery: itching, pain, flashing lights, floaters, a curtain in your vision, redness, severe headache, nausea, vomiting, sensitivity to light, or watery eye. Please note, warnings and precautions accompany all IOLs because they are prescription-only medical devices. The following warnings and precautions apply to all multifocal IOLs. A very small number of patients, less than 1% in U.S. clinical studies, may be dissatisfied and request removal of their multifocal IOL. Under poor visibility conditions, your vision may be reduced more than it would be with a monofocal IOL. Under these conditions, you may have more difficulty recognizing some traffic signs and hard-to-see objects in the road. Therefore, you may need to take extra care when driving, especially in poor light conditions. In rare instances, multifocal IOLs may make some types of retinal surgery more difficult. If your eye is not healthy, including glaucoma, your vision may not be good even after your cataract is removed. In this case, you may not get the full benefit of the multifocal IOL. Before surgery, your eye doctor will check to see if you have any eye diseases. Be sure to tell your eye doctor if you have any health conditions that may affect your surgery or vision, and provide an updated list of medications to the doctor. There is a chance that your vision with a multifocal IOL may not be good enough to perform very near or detailed up-close work without glasses. The Tecnis Multifocal IOL is designed for near vision at approximately 13 inches. Take all prescribed medicines and apply eye drops as instructed. You should avoid any activity that could harm your eye while you are recovering from surgery. Before and after the surgery, your eye doctor will tell you about activity restrictions. If you wear contact lenses, your eye doctor may ask you to discontinue wearing your lenses prior to being evaluated for the multifocal IOL. There were no patients 21 years old or younger included in the clinical study. As a result, there are insufficient data to support safety and effectiveness of this IOL in this age group. The most frequently reported adverse event that occurred during the clinical trial of the Tecnis multifocal lens was surgical reintervention, which occurred at a rate of 3.7%, lens-related 0.6%, non-lens-related 3.2%. Surgical reintervention included lens exchange, retinal repair, iris prolapse wound repair, trabeculectomy, lens repositioning, and lens removal due to patient dissatisfaction. The second most frequent adverse event was macular edema, which occurred at a rate of 2.6%. Other reported reactions were hypopyon and endophthalmitis. each occurring at a rate of 0.3%.